I think that's such a great topic, Sandy, because heart disease is the leading cause of death in women in the United States, and it has been for decades. So let me say that again. It's the leading cause of death in women, not breast cancer, not any of the things that we are tested and screened for most aggressively. It's heart disease, and it's so frequently missed. In fact, last year, 2025, BMC Public Health issued they did a study taking a look at a couple of decades worth, actually 1 decade, 10 years of public health data. And in it, they found that 63% of women who had angina or like chest pain, that diagnosis, it was missed. And if we think about it, like the way in which they're evaluating it, because it's based on a male model, a male framework, that number is probably a lot higher. So women's physiology is not men's physiology. We are not just little men. So, women's cardiac symptoms often look different. We all know of this, the classic heart attack, not heartache, but the heart attack symptoms like chest pain and what have you on the left-hand side. But for women, it can look very different. It could just be profound fatigue that doesn't necessarily recover with rest. It could be nausea, shortness of breath. It could be jaw pain and anxiety. These aren't that classic, crushing chest pain kind of symptom that every cardiac awareness campaign is, putting on a poster. And so when a woman goes to the emergency room with those symptoms, fatigue and nausea, the probability that her cardiac status is going to be fully investigated is probably a lot lower. So all the diagnostic tools, the stress tests, the risk calculators, the standard lipid panels, they're all validated in populations that didn't necessarily represent fully the female physiology. And that's a systems problem, right? And it's why is it important, especially in this age and stage of life? Estrogen is actually a beautiful and cardioprotective hormone. And our cardiovascular system depends on it in so many different ways that, again, most annual exams don't address. A decade before menopause, not decades. That's the time frame where most women start to experience these massive fluctuations in estrogen. And when that happens, that the whole cardiovascular picture starts to shift in ways very silently. Before anything kind of overt or apparent happens. So there are, when our estrogen levels go down, our arteries become less compliant, meaning they get stiffer, right?